We've been talking about Governor Polis's edict yesterday, transitioning from the stay-at-home order to a safer-at-home order. It starts next week. Many experts say these decisions need to be driven by data and science. So let's take a look at the science, factors that go into the decision-making with our 9 Health expert, Dr. Payal Kohli. So let's dive right into it. What are the considerations we need to have when deciding when to open and what to open, Payal?
So, Tom, there's 4 main factors that we really need to look at that tell us whether or not it's safe to open. The first is the trajectory of the cases. So are we going up the mountain? Are we at the top of the mountain? Are we coming down the mountain? And in New York, we've seen that Governor Cuomo has stated they're coming down the mountain. I'm worried that here in Colorado, we're still going up the mountain because the cases have not peaked off. They're increasing every day. And the White House task force has told us that we need to have 14 days straight of cases coming down before we can start to think about easing those restrictions. The second thing we need to think about is that R0, which is the reproductive number of the virus. And we were told in early April that that reproductive number is actually 3 to 4, meaning every person that has it infects 3 or 4 others. It needs to be below 1 for us to ease those restrictions. The third factor that we need to think about is the testing, whether we have adequate testing. And Governor Polis acknowledged yesterday that we don't have adequate testing at this time, but really we need to look at that rate of positive testing. So here in Colorado, we're having a 21% positive rate, and that's just too high. What we've heard from the WHO is that it needs to be under 10% for us to know that we're doing enough tests. And then that final is, do we have that army of people that we need to do contact tracing? Do we have treatment resources? Do we have PPE? And those numbers are also skeptical. If we open up the floodgates and start doing elective surgeries in the hospital, are we going to have room for our COVID patients if we see that spike?
Yeah, testing, tracing, and treatment, but we don't know much about those answers yet. But some of these specific industries that are going to be allowed to reopen again include places like nail salons, even tattoo parlors. I imagine that's something you're not too comfortable with.
Yes, you read my mind, actually. So I asked myself 2 questions when we talk about which businesses to open. How essential are they, and how close is the contact? And for nail salons and tattoo parlors, they're not essential businesses, and there's extremely close contact where you're physically touching someone. Now take a look at this diagram, which was a study out of China that tells us about a restaurant. So we're not quite at opening restaurants here in Colorado, but we know Georgia is planning to open them on Monday. The person in yellow was the person infected. And they infected 9 other people. You can see that was 4 people at the same table and people at other tables as well. And all the way on the right, you see that that's where the ventilation system was, the air conditioning. So one of the things we're learning is that this asymptomatic person who was sitting at a table relatively far away from some of the other people that they infected actually had their respiratory droplets potentially carried across the room by the ventilation system. Now you can see that this could be extrapolated to a hair salon where I'm sitting and getting my hair done, the blow dryer is on, blowing my respiratory droplets to the person sitting next to me. And you know, the risk of getting infected depends on how long you're in that place, and usually in places like hair salons you're there for at least an hour, similar to a massage parlor, similar to a restaurant. So these are things we really have to think about, because if we don't have our testing in place, we're allowing the social distancing to relax. In a few weeks, we're going to see people showing up at the hospitals and dying.
Well, it's obviously stuff that people are trying to consider and trying to learn more about, but ultimately I think many people will have their own health at stake and make their decisions on their own as these guidelines start to relax a little bit. Payal, it's always good to talk with you. Thanks for visiting with us again. Our 9 Health expert, Dr. Payal Kohli.